Good morning. My name is Terry Foster, and thank you for being here today. My presentation is titled The Hidden Link Trauma and Substance Abuse. This is a topic that affects millions of individuals across different age groups, backgrounds, and communities. Today, I will walk you through the research, current trends, future implications, the societal impact of this complex relationship. Let's start with some definitions. Trauma refers to deeply distressing or disturbing experiences which can be physical, emotional, or psychological. These two issues are often intertwined. Many people use substance to cope with trauma, which can lead to addiction. This presentation will explore how trauma influences substance use, what research tells us, and what we can do moving forward. There's different types of traumas. Acute trauma that happens from a single event like a car accident. Chronic trauma builds up over time like an ongoing neglect. And lastly, complex trauma, as when someone experiences multiple traumatic events, often starting in childhood. Trauma can mess with the brain development, emotional regulation, and even how someone handles stress later on in life. Historically, the link between trauma and substance abuse wasn't well understood. In the 1980s, studies on Vietnam veterans revealed high rates of PTSD and substance use, which helped shift the narrative from moral failure to mental health. Over time, researchers began to see an addiction as a coping mechanism for unresolved trauma. This historical context is important because it laid the groundwork for today's trauma informed approaches. This connection between trauma and substance use is huge. Many people who struggle with addiction have a history of trauma, and sometimes the addiction starts as a way to deal with those painful experiences. Understanding this connection helps us create better support systems and treatment options that actually address the root causes and not just the symptoms. The adverse childhood experiences, or other people call it ACEs, is a study that is foundational in understanding how early trauma impacts long-term health. It showed that the more traumatic experiences a person has in their childhood, like abuse, neglect, or household dysfunction, the higher the risk for substance abuse, mental illness, and chronic disease. This study shifted how we view addiction, not just because of personal failure, but as a response to deep, unresolved pain. It's one of the most cited pieces of research in trauma informed care. When these parts don't develop normally, people might struggle with impulse control and emotional regulation, which can make them more likely to use substance to cope. For example, ENDA ETL 2006 found that childhood trauma can lead to long-term changes in how the brain handles stress. When people experience trauma, they often seek relief through coping mechanisms, some healthy, some harmful. Substance use can become a way to numb emotional pain, escape flashbacks, or manage anxiety. But over time, this coping strategy can spiral into dependency. It's important to recognize that for many, addiction starts as survival. This insight shifts how we approach treatment from punishment to compassion. A lot of people who experience trauma turn to drugs and alcohol to deal with emotional pain. Research shows that trauma survivors often use substance to self medicate, especially when they don't have access to support systems like therapy or community resources. It's not just about getting high, it's about trying to feel normal and escape painful memories. Brain chemistry and addiction. Trauma can also mess with the brain's chemicals like dopamine and serotonin, which affects mood and reward. Research from 2008 explains that stress and trauma can increase cravings and make relapse more likely, even for the people who are trying to recover. So basically, trauma doesn't just lead to substance use, it makes recover harder too. One of the most influential studies in this area is the ACEs study, like I mentioned before. It's found that individuals with four or more ACEs are significantly more likely to develop substance use disorders. This includes experiences like abuse, neglect, household dysfunction, and today we see trauma related addiction in youth, veterans, marginalized communities. For example, American Indian and Alaska Native populations have some of the highest rates of substance use disorders, often linked to historical trauma. People with four or more ACEs are 7 times more likely to develop alcoholism, 10 times more likely to use to injection drugs, and 2 times more likely to be diagnosed with depression. There's a growing movement towards trauma informed care across healthcare, education, and criminal justice systems. This means recognizing signs of trauma, avoiding re traumatization, and creating safe environments. Programs now integrated mental health support, peer, peer mentorships, and holistic healing. This shift is slow but promising, especially for marginalized communities who have historically been overlooked and blamed for their struggles. Around 75% of women in substance use treatment programs report history of trauma. More than 60% of adolescents in treatment for substance use disorders have experienced physical or sexual abuse. Societal impact shows that substance abuse linked to trauma costs the U.S. billions each year in healthcare, lost productivity, and criminal justice expenses. Communities with high rate of poverty and violence often see higher rates of trauma-related addiction. Trauma doesn't exist in a vacuum. It's shaped by systematic issues like poverty, racism, and community violence. These factors increase exposure to trauma and reduce access to treatment. Stigma also plays a huge role. Many people, especially in the marginalized communities, avoid seeking help due to the fear of judgment or discrimination. Addressing these cultural and systematic barriers is essential for effective intervention. The ACEs study shows how we understand trauma. It's used in schools, healthcare, even criminal justice to identify people at risk. More places are screening for ACEs to catch trauma early and prevent addiction later. CDC reports that ACEs are linked to higher rates of substance use, mental illness, and even chronic diseases. There's a big push for trauma informed care, especially in addiction treatment. This means providers are trained to recognize signs of trauma and respond with empathy, not judgment. Programs now focused on more of healing the root causes and not just drug use. Research shows that trauma and addiction aren't just connected in one group. It's a pattern across cultures and backgrounds. Research also emphasizes trauma informed care, which means recognizing how trauma affects behavior, adjusting treatments to be more supportive. This shift is to helping people feel safer and more understood in recovery. Who's affected? These issues touch as many lives, from young people in unstable homes to veterans coping with PTSD. For example, a teen growing up around domestic violence might use substances just to feel safer and control. We made progress with trauma informed care, but we still need more prevention and community support to break the cycle. More prevention, early support, and community healing are needed. There's been progress, like increased funding for mental health services, the rise of trauma informed schools, and more research in addiction recovery. But gaps remain. Many people still face stigma, lack of access, or treatments that don't address root causes. We need more integrated care models, community based healing, and policies that prioritize prevention over punishment. What can be done? Expand access to trauma informed services, especially in underserved communities where trauma and addiction are often compounded by systematic barriers. Integrate trauma education in schools. Early, early intervention can reduce long term risk by teaching coping skills and emotional regulation. Invest in community healing programs, support groups, peer mentorship, and culturally responsive care can foster resilience recovery. Use data-driven policies. Leverage ACEs related research to inform funding, prevention strategies, and equitable resource distribution. Healing from trauma is not just clinical, it's community, educational, and political. Looking ahead, trauma informed care is gaining traction in healthcare settings. This approach recognizes the impact of trauma and avoids re traumatizing patients. On the policy side, legislation can mandate trauma screening in schools, prisons, and hospitals. These changes could help identify at risk individuals early and connect them to appropriate services. Policy. Trauma informed legislation could help reshape how addiction is treated in schools, prisons, and healthcare systems. Policies that mandate trauma screening and staff training would ensure more people to get the support they need early. Healthcare. Trauma screening into addiction treatment could catch underlying issues before they escalate. This requires provider education and a shift away from purely symptom based care. Education. Training addiction counselors and mental health professionals in trauma sensitive approaches can reduce re traumatization and improve outcomes. Schools and universities also play a role in preparing future providers. Technology. Data analytics can help identify individuals at high risk for addiction based trauma history. These tools may personalize treatment plans, help with any concerns and biased concerns as well. My final thoughts. Trauma and substance abuse are deeply intertwined, shaping lives across generations, but understanding this connection gives us power the power to respond with empathy, to design systems that heal rather than punish, and to advocate for change that reaches beyond the clinic. We must move from awareness to action, from isolated treatment to integrated care, from surviving trauma to building resilience. When we treat addiction without addressing trauma, we miss the root. But when we center healing, we open the door to lasting recovery. These are the sources that informed my research. I focused on peer reviewed studies from the last decade, including foundational work like the ACEs study and newer insights into trauma's impact on the brain and behavior. Each source helped me connect the dots between trauma, substance use, and the need for compassionate, evidence based care.